You went to bed at 10 last night. You slept 7 hours, maybe 8. By every measure, that should mean a fully rested body and a clear head this morning. But you opened your eyes, and the first thing you felt was your neck, a sharp pull on the right side. You tried to sit up, and your shoulder screamed. Your right arm was numb to the elbow, the kind of dead weight that takes 30 seconds to come back to life. Your lower back ached the moment your feet touched the floor. There was a burn in your chest from the chicken you ate at 6 o'clock last night, still sitting there like it never left. You walked to the bathroom and you felt 75 years old, not 62. You blame your mattress. You blame the dinner. You blame your age. You tell yourself you need a new pillow, or maybe magnesium, or maybe you are just getting old. You are wrong on every count. There is one thing you have never blamed in your life, and it is the actual cause of every single one of those symptoms. 8 hours a night, 3,000 hours a year, 240,000 hours by the time you are 80. You spend a third of your entire life in one position, and after the age of 55, the position you sleep in determines whether your body recovers overnight or quietly destroys itself. There are 7 sleeping positions silently damaging the body of every adult over 55. You are almost certainly using at least 2 of them every single night without knowing it. By the end of this video, you will know exactly which position to switch to tonight and what specifically your current position has been doing to your spine, your heart, your brain, and your digestion while you slept. Quick, if this is helping you, help this channel reach 100,000 subscribers. We are growing because people share content that genuinely changes how their body feels. Now let me say something. Almost no one over 55 has ever been told. Sleep duration is overrated. Sleep position is everything. A man who sleeps 6 hours in the correct position will wake up more recovered than the man who sleeps 9 hours in the wrong one. Your body is not a machine that runs on time. It is a network of pipes, valves, pressures, and gravity-dependent flows. The angle at which you park that network for 8 hours determines what flows correctly, what gets compressed, what gets starved of oxygen, and what gets flooded with acid. Think of it this way. A car can be parked overnight on a level driveway, and the engine is fine in the morning. Park that same car on a 45-degree slope and leave it there for 8 hours, and the oil drains the wrong way, the brake fluid pools, the tires deform on one side. The car did not fail. Gravity acted on it for too long in a position it was not built to hold. Your body is the car. Sleep position is the slope. After 55, the margin for error disappears. The cartilage in your joints is thinner. The discs between your vertebrae have lost their water content and no longer cushion impact the way they did at 30. The valves in your veins are weaker. The muscles that hold your jaw and tongue forward during sleep have lost tone. Your stomach's acid barrier is more fragile. The lymphatic system that clears waste from your brain has become exquisitely dependent on body position to drain properly. What was a forgivable habit at 35 becomes a slow-motion injury at 65. Before I walk you through the 7 positions, one important note. If you wake up gasping for air, if you have morning headaches that do not clear within an hour, if your spouse tells you that you stop breathing during the night, if numbness in your hand does not resolve within 2 minutes of waking, those are not sleep position problems alone. Those are signs to see a doctor for a sleep study and a vascular evaluation. The information here supports your body. It does not replace a clinical workup when something is genuinely wrong. Now, the 7 positions. Identify yours. Position 1. Sleeping on your stomach, face turned to the side. This is the worst sleeping position the human body can adopt, and roughly 7% of adults do it every single night. Here is what is happening for those 8 hours. To breathe through your nose or mouth while lying face down, you are forced to rotate your neck 90 degrees to one side. Hold your head turned that way right now for 30 seconds and notice how it feels. Now imagine holding it for 8 hours. The cervical spine, the 7 small vertebrae in your neck, is locked in maximum rotation while the muscles around it strain to support the weight of your skull at an angle they were never designed for. By morning, those muscles are exhausted, the small joints between the vertebrae are inflamed, and the nerve roots that exit your spine to feed your arms and shoulders are under chronic compression. This is also why prone sleepers have higher rates of teeth grinding, jaw pain, and morning headaches. The pressure of your face against the pillow distorts the alignment of your jaw all night. And the position physically compresses your chest and diaphragm into the mattress, reducing lung volume by an estimated 30%. You are sleeping in a low oxygen state for 8 hours every night. Position 2. Sleeping flat on your back without any head elevation. For some people, this is fine. For most people over 55, this is a quiet disaster. 3 things go wrong when you sleep completely flat on your back. First, gravity pulls your tongue and the soft tissue at the back of your throat backward, narrowing your airway. If you have any tendency towards snoring or sleep apnea, this position dramatically worsens it. You stop breathing for short stretches without knowing it, your blood oxygen drops, and your heart works overtime all night to compensate. Second, when your stomach is at the same level as your esophagus, stomach acid moves freely upward through the lower esophageal sphincter. The result is silent reflux, a slow burn against the lining of your throat that you may not feel until you have a chronic cough or a hoarse voice. Third, the natural curve of your lower back loses its support, and the lumbar spine flattens against the mattress, stretching the small joints behind the vertebrae and producing the ache you feel when you stand up in the morning. Flat on your back is not wrong for everyone, but if you snore, if you have any reflux, if you wake up with a sore throat or lower back pain, this position is part of the cause. Position 3. Sleeping on your right side. This will surprise you because most people assume side sleeping is universally good. Side sleeping is good. Right side sleeping is not. Your stomach is shaped like a curved bag, with its outflow on the right side draining downward into the duodenum. When you lie on your right, that natural drainage is interrupted. Stomach contents pool against the lower esophageal sphincter, the muscle ring at the top of the stomach, and acid leaks upward into the esophagus. Research consistently shows that right side sleeping increases nighttime reflux episodes compared to left side sleeping. If you wake with a sour taste, a dry mouth, a chronic morning cough, or unexplained chest discomfort that goes away when you stand up, the right side is a major contributor. There is a second issue. On the right side, the heavier organs of your abdomen, the liver and intestines, press inward against the inferior vena cava, the largest vein in your body, which returns blood from your lower body to your heart. Compression of this vein reduces venous return all night. Over years, that contributes to leg swelling, restless legs, and morning lightheadedness when you stand up too fast. Position 4. Side sleeping with your arm tucked under your head or under the pillow. This one looks comfortable. It feels comfortable when you fall asleep. By morning, your arm is dead, tingling from the shoulder to the fingertips. The medical name for this is positional brachial plexus compression. The bundle of nerves that runs from your neck through your armpit and down your arm gets pinched between your shoulder, your collarbone, and the weight of your skull. Hold that compression for 6 hours and the nerve becomes inflamed. In some cases, particularly when alcohol or medication makes you sleep too deeply to shift, the nerve injury becomes prolonged. There is even a clinical name for the version that happens when someone falls asleep too soundly with an arm bent under their head, Saturday night palsy. Your hand can be weak for days afterward. Beyond the nerve compression, this position drives one shoulder forward and tilts your spine, creating chronic asymmetric strain on the upper back and neck. Position 5. The tight fetal curl. Knees pulled all the way up to the chest, chin tucked down toward the knees, spine rolled into a comma. This feels protective. Many people sleep this way during stress or in cold weather. The problem is mechanical. When you curl tightly, your diaphragm, the dome-shaped muscle under your lungs, is compressed by your bent knees and abdomen. Your lung capacity drops significantly. You breathe shallowly all night. The space between each vertebra is narrowed. The discs are forced to maintain a flexed position for hours, which is exactly the position that puts the highest pressure on them. People who sleep in a tight fetal curl wake with the lower back pain of someone who spent the night doing slow-motion sit-ups. A loose curve is fine. A tight curl with knees crushed against the chest and chin tucked is mechanically punishing. Position 6. Head propped up too high on multiple pillows. You stack 2 pillows, sometimes 3, because it feels supportive. What is actually happening is that your chin is being pushed forward and down toward your chest. The cervical spine is forced into severe forward flexion all night long. This compresses the front of the discs between your neck vertebrae, strains the muscles at the back of your neck, and critically for people over 55, interferes with the drainage system at the base of your skull. The brain has its own waste clearance network called the glymphatic system, which clears out metabolic byproducts, including the proteins associated with cognitive decline. The glymphatic system runs primarily during deep sleep, and it depends on free flow at the cervicomedullary junction, the place where your spine meets your brain. A neck folded forward all night impairs that flow. If you wake with a stiff neck and brain fog that takes an hour of coffee to clear, your pillow stack may be the cause. Position 7. Side sleeping with one leg crossed over the other, knees stacked tightly with no pillow between them, or worse, the top leg slung across the lower body in a twisted position. This rotates your pelvis, which forces your lumbar spine to follow, creating chronic torsion in the lower back. The hip joint of the top leg is pulled into adduction, meaning across the midline for hours. This stretches and irritates the structures around the sciatic nerve, which is why so many people over 55 wake with hip pain, lower back stiffness, and a tingling that runs down the back of one leg. The sacroiliac joints, the small joints at the base of the spine that connect the spine to the pelvis, are loaded asymmetrically all night. Over years, this drives the chronic one-sided lower back pain that almost everyone past 60 assumes is just arthritis. That is the 7. Read them again. Stomach. Flat on the back without elevation, right side, side with arm under the head, tight fetal, head propped on multiple pillows. Twisted side without leg support. If you recognize yourself in 2 or more, you have your answer. Now I want you to meet someone. I will call her Margaret. 64 years old, retired school teacher, walks her dog every morning, eats well, sleeps 8 hours every single night. And every morning, for the past 4 years, she has woken up exhausted, foggy until 11, pain in her right shoulder, numbness in her right hand that takes 10 minutes to clear. She tried melatonin, she tried magnesium, she bought a new mattress, she bought blackout curtains. She spent $1,100 on a smart sleep tracker. None of it changed anything. The question that finally cracked her case was not about her sleep schedule. It was a single question. What position do you actually sleep in? She did not know. She fell asleep on her back, but she always woke up on her stomach with her head turned to the right. She had been doing this for 35 years. Margaret made one change. She put a body pillow against her front, hugged it, and slept on her left side. She kept a thin pillow between her knees. The first 3 nights were uncomfortable. By the second week, she was sleeping through. By the 4th week, the shoulder pain was gone. The numbness was gone. The morning fog was gone. She did not change her diet, her exercise, her supplements, or her bedtime. She changed the position of her body for 8 hours. The result was the recovery she had been chasing for 4 years. So what is the correct position? There is one. It is left side, sleeping with 3 specific supports. Left side. Why left and not right? Your stomach drains downward to the right under normal anatomy, which means lying on your left side keeps stomach contents below the level of the lower esophageal sphincter. Acid stays where it belongs. Reflux drops dramatically. Beyond that, the heart sits slightly toward the left of the chest cavity, and when you lie on your left side, the heart is positioned freely without the weight of the liver and intestines pressing against the major vessels. The thoracic duct, the largest lymphatic channel in the body, drains on the left side of the neck. Gravity assists that drainage when you sleep on the left. And research suggests the brain's lymphatic system, the waste clearance pathway I mentioned earlier, operates most efficiently in the lateral position, with some evidence favoring the left side. Slight head elevation, not multiple pillows stacked vertically. One pillow that is tall enough to keep your neck in a straight line with your spine, meaning your nose, your sternum, and your navel, all stay in the same horizontal plane. If you can imagine drawing a line through those 3 points, that line should be straight. If your head tilts down toward the mattress, your pillow is too thin. If your head tilts up toward the ceiling, your pillow is too thick. For most people, this means a single medium firm pillow. Pillow between the knees. A small pillow, even a folded blanket, placed between your knees keeps your pelvis level instead of letting the top leg pull your hip downward and twist your lower back. This single change resolves a remarkable amount of chronic hip and lower back pain in people over 55. A pillow to hug. Holding a body pillow or a regular pillow against your chest does 2 things. It supports the top arm so it does not collapse forward and rotate your shoulder. And it physically prevents you from rolling onto your stomach during the night. For lifelong stomach sleepers, this is the single most important transition tool. Slight bend at the knees, not a tight fetal curl. Your knees should be bent at roughly 45 degrees, comfortably stacked with the pillow between them. Now, here is the honest part. If you have been sleeping on your stomach for 40 years, you cannot simply lie down on your left side tonight and hold the position until morning. Your body will roll back into its habit within an hour. The retraining takes 2 to 3 weeks of consistent setup. For lifelong stomach sleepers, the most effective trick is a tennis ball sewn or pinned into the front pocket of your pajamas. When you try to roll onto your stomach during the night, the discomfort wakes you just enough to roll back. After 2 weeks, you stop trying. The habit dissolves. For lifelong back sleepers who need to switch to the side, a body pillow placed firmly along your back acts as a wall. You cannot roll backward. You stay on the side. For people who switch sides during the night and find themselves on their right by morning, the same body pillow technique works in reverse, against your front instead of your back. The first 3 nights will feel strange. The 4th through 10th nights will feel adequate. By the 3rd week, you will not be able to imagine sleeping any other way, and you will notice, usually first in your shoulders, then in your lower back, then in your morning energy, that something has fundamentally changed. Here is what to do tonight. Before you go to bed, set up the supports. 1 firm pillow under your head, sized so that your neck stays in line with your spine. 1 pillow between your knees. 1 pillow to hug against your chest. Lie down on your left side. Bend your knees slightly. If you snore, slightly elevate the head of your mattress by placing a folded towel under the top of the mattress. Or use an adjustable bed if you have one. About a 15-degree elevation is ideal for reflux and apnea-prone sleepers. In the morning, before you do anything else, notice 3 things: the state of your neck, the state of your hands and arms, any numbness or tingling, the presence or absence of that burning sensation in your chest. Make a mental note. Repeat the same setup tomorrow night. Do this for 3 full weeks. If you have severe reflux, sleep apnea diagnosed by a doctor, recent shoulder surgery, or a pinched nerve, talk to your physician before making changes. For the great majority of people over 55, this single change will be the most consequential thing you do for your sleep this year. One more thing before you go. I want to know who is watching this video. Specifically, I want to know your age, the city or country you are watching from, and which of the 7 positions you recognized as yours. Write all 3 in the comments: your age, your location, and the position number. This information directly shapes what I cover next, and the videos that follow will be calibrated for the people in this audience. If this video helped you, send it to someone you care about: a husband who snores, a wife who wakes up exhausted, a parent who has been chasing better sleep for years. They may have just been sleeping in the wrong position the entire time, and one short message from you might be the thing that finally fixes it. Tonight, set up the pillows, lie on your left side, give your body the angle it was built for.